Today, we've got a question that many of you might relate to. I've noticed my hands are shaking more lately. Should I be worried? Well, we're here to break it down for you. Understanding hand tremors, when to be concerned. 1. Hand tremors, normal or not? First things first, if you've noticed your hands shaking a bit, don't hit the panic button just yet. It's actually quite common to have a very low amplitude, high-frequency tremor that's considered normal. Try placing a sheet of paper on your outstretched hand, palm side up, and you'll see that little shake. 2. Age and tremors. As we get older, this normal background tremor might become more noticeable in everyday activities. In fact, around 25% of people over 70 have some form of visible tremor. So, age can play a role here. 3. Potential triggers. Now, what could make these tremors more noticeable? Well, there are potential triggers like extreme fear, anxiety, fatigue, fever, or even vigorous exercise. Certain substances like alcohol, caffeine, and specific medications can also make your tremors more pronounced. 4. When to see a doctor? If you have a new tremor with no obvious trigger, it's time to talk to your doctor. Sometimes, tremors can be a sign of underlying conditions like Parkinson's disease or multiple sclerosis. 5. Causes of tremors. Tremors are essentially involuntary movements caused by quick, alternating contractions of opposing muscles in your body. These can be related to various factors, including neurological conditions. 6. Essential tremor. This is when your tremor occurs more with action, like trying to type, hold a fork, or even shave. It can run in families and often affects both hands symmetrically. Sometimes, alcohol might provide temporary relief, but it can worsen the tremor in the long run. 7. Treatment options. Luckily, there are treatment options available, such as medications like propranolol and primidone, or even deep brain stimulation. It's essential to keep your doctor informed, especially if you notice any health changes. 8. Parkinson's disease. Now, for those with Parkinson's disease, tremor is often the first symptom. It typically starts in one hand while at rest and may involve a rolling motion with the thumb and forefinger. Medications that boost dopamine levels can be beneficial for Parkinson's patients. 9. Multiple sclerosis. Tremors can also affect individuals with multiple sclerosis, an immune-related disease of the central nervous system. These tremors often come and go during attacks of neurological symptoms. 10. Wilson's disease. Lastly, there's Wilson's disease, a less common cause of tremor. It's usually diagnosed in younger patients and is linked to a genetic defect causing copper accumulation in the body. If you've noticed your hands shaking a bit, it might be nothing to worry about, especially if you can pinpoint a cause like caffeine or fatigue. But if it's a new, persistent tremor with no clear trigger, it's time to consult your doctor. Remember, early detection can make all the difference. If you found this information helpful, don't forget to hit that like button and subscribe for more health insights and advice. And as always, share your thoughts and questions in the comments below. Thanks for tuning in, and we'll see you next time.